actually show you the clinical technique for fabricating an anterior bite appliance and then for delivering one. The design of an anterior bite plane is to get posterior tooth disclusion, so no posterior teeth will be touching bicuspids or molars in either intercuspal position or in any of the excursive movements. So why do we use this appliance design? We use it because what we know is that it's the muscles that are activated, that are creating the force, the load that is making the muscle symptomatic, could be loading the joints as well as damaging the teeth. It's that proprioceptive message that comes from our posterior teeth, our bicuspids and our molars, that tells our brain to fire those elevator and positional muscles. And so the appliance design is basically to trick our proprioceptive system, get those teeth out of contact so those muscles are not getting a message and then will therefore release, alleviating the signs and symptoms of muscle discomfort and also potentially unloading the joints and protecting the tooth. So the first step in fabricating an anterior bite plane appliance is going to be that we need a model to work from. So what we've simply done off camera is we've taken an alginate impression on Katie of her upper arch. So I don't need the lower and I don't need bite records, I simply need the upper. Cons are of stone. I actually make a silicone model, and I do it for two reasons. One, it's a very, very quick technique, so I can have a model, as you're going to see here, in probably about 90 seconds or so. The other reason I do it is because the silicone model is very easy to work with. With the BioAcryl, I don't need a spacer to prevent it from getting too tight, so it just makes the entire process quick and easy. We're going to actually use Mach 2 dye silicone, and Mach 2 is a product from Parkel, and it's a fabulous product for making these models. And we're going to then base the model using bite registration paste. So the reason we use the bite registration paste to base the model is it's much easier to dispense, it creates a great model, and I don't need the accuracy of the Mach 2 like I need in the actual teeth or the occlusal tables. So how I'm going to do this first is I've got my Mach 2, I've got my tip on here. You can notice I do have the little yellow intraoral tip. And the first thing I'm going to do is I'm actually going to cut the tip back just using some scissors so that I'm going to actually be able to express more material out more readily. And I've got my bite registration paste let, and you can see that I'm working on a vibrator. One of the hardest things about this technique is being able to do it without getting bubbles in the model, and the Mach 2 tends to set very rapidly. Now they do make a product called Mach Slow that in the beginning you may want to try because it'll give you some more working time. And once I've got just the occlusals all full, I can now turn the vibrator off. And now we're going to complete the model using bite registration paste. And so this is just my Flexitime bite registration paste from Ariz. And now I'm going to fill all the way up past where the alginate went down in the vestibule. I'm not going to fill the palate on this upper, I'm just going to create a horseshoe. So now that everything is completely set, it's very simple to separate the alginate. And we have a model, and it just should peel right off of the countertop or right off of, in this case, the vibrator. And now you can see we have an accurate representation of all of the teeth past the cervical margins, and we have this nice silicone base. As soon as I push this out of the way, it turns the heat off. I simply flip this over, lock it down, and now my mini star has automatically started to create the air pressure. And for this material, what it's saying is it needs about 51 more seconds. And once I have it where I want it, then it's just simply a matter of light curing, and then we'll be able to do our adjustments. So the next thing we're going to do is just finalize our occlusion. So I'm going to simply have Katie bite together, and I'm going to take a look. And what's happening for Katie now is she's pretty much just occluding on this one canine. On her lower, on her left-hand side, it's a little taller. So we're going to start adjusting it.